This is the Wrap on Aging, and I'm Rob Ence, your host with the Utah Commission on Aging, broadcasting from Scope Radio. The Wrap on Aging explains public policy, education, and research that informs and empowers Utah's older adults and connects you and your family to the many resources and services. Today, the Wrap on Aging discusses the nursing shortage crisis in Utah and how it can and will affect you, your family, and community, and I mean all ages. Babies to grandmas, and everyone in between. Let me tell you why. There are 1,200 jobs available for professional nurses in hospitals, nursing homes, clinics, rehabilitation facilities across Utah. These healthcare providers are ready, willing, and able to hire nurses in critical positions. There just aren't enough qualified nurses to fill those jobs. And it's not getting better. It's getting worse. We've asked Teresa Garrett to help us understand what's behind Utah's nursing shortage and what needs to happen to fix it. Welcome, Teresa.
Thanks, Rob. Happy to be here.
Teresa is the project director for the Utah Nursing Consortium and assistant professor of nursing at the University of Utah. So, Teresa, just exactly what do we mean when we say we have a nursing shortage crisis?
Nurses are a critical component of the healthcare workforce. And in fact, they're the largest component of the healthcare workforce. There are nearly 30,000 nurses in the state of Utah. When you think about that, you think, well, isn't that enough? And it's not enough. We've never had enough nurses in the nursing workforce. Nursing has always been a high demand job, with a few rare occasions when we have an economic downturn. There are always vacancies in the nursing workforce. When you mentioned that there are 1,200 jobs available, those are vacancies. There are thousands of nurses in the nursing workforce and in the healthcare workforce. And today we're dealing with vacancy rates that are higher than we've seen them in a very long time.
So there are some very unique circumstances we're confronted with as the demography shifts in our communities. Let's talk a little bit about what's creating this perfect storm. Talk to us a little bit about what's happening with the aging population, a topic that you and I are both pretty familiar with.
Well, one of the wonderful things about Utah is that we are very young and we are also very old. So we are the youngest state in the nation, which means we have lots of children who need care. We also have one of the fastest growing over 85 age populations in the country, if not the fastest.
I believe it is the fastest.
And that's a unique group of people who, believe it or not, are fairly healthy, except for when they're not. And then when they're not, they're dealing with multiple chronic illnesses and diseases that have lots of compounding health effects. So I think about my mother-in-law. She's almost 89 years old. Sweetest woman I've ever met, next to my own mom, who's almost 85 years old. And they are both really healthy people, except for when they're not. When my mother-in-law, who has some pretty advancing dementia issues, falls down and breaks something, because she's a little bit on the brittle side, that has an impact not only on her own health and her own ability to take care of herself and stay in her home. It also has an impact on us as caregivers and family members, her neighbors. There's a ripple effect that happens with that. And it's probably not unique to the over 85 crowd. It happens when anybody gets sick. When my grandchildren get sick, it impacts my son's ability to go to work, my daughter-in-law's ability to teach dance class. It often affects my ability to get to work because I need to help them. We help each other. That's what we do here in Utah. But we also need a solid and robust healthcare workforce to be able to help us.
So there are some other issues I came across that deal with the challenge that many in our nursing workforce right now, I think about half, are within 15 to 20 years of retirement. Talk to us a little bit about what the impending challenge is there.
So we have this unique thing happening in our population. We also have a really unique thing happening within the nursing workforce itself. Nurses on average are about 47 years old. So we're sort of tipping the scale towards the older end of the spectrum in the workforce as opposed to the younger end of the spectrum. which means we're closer to retirement. If you think about the fact that the last of the baby boomers will retire in 2029, that's not very many 11 years far from now. So that's a really interesting thing to think about. And so that means about half the nursing workforce could retire in the next 15 years. I'm not sure that they will. Nurses have a tendency to stay in the workforce. They may not be at the bedside, but they stay in the workforce for longer than that. But that means that the availability of people to provide direct care is limited. So our workforce is changing. And that is quite a challenge for employers to think about how do we make that safe for people to continue working at the bedside, which is where the vast majority of nurses work. So that retirement piece and that aging of the nursing workforce itself is a pretty critical issue. The other piece that's coming along with that is the aging of the nursing faculty. So nurses get older, so do faculty members. And when you think about the retirement of the nursing faculty resource, then you've got a problem with, okay, if we want to educate more nurses, how do we do that? We need to make sure that we have a robust nursing faculty as well.
So let's set that up a little bit. I want to talk a little bit later in a segment about the faculty challenge and what we're doing to address that. But do we have enough individuals entering the nursing profession, entering the nursing schools? We've talked about the challenge of a changing demographic. We've talked about retirement being an issue we have to address. What about the influx?
So Utah, on average, needs about 3,000 to 4,000 nurses a year to keep up with the change. And right now we're educating about 1,500 nurses a year through the various schools across the state and programs. And that means we're recruiting nurses from outside the state to come fill in that gap. Well, what's happening in Utah is also happening nationally. The number of nurses that are needed nationally is going to exceed the 1 million mark very soon. And so we're not going to be able to continue to recruit nurses into the state to deal with that issue. So the imbalance between the number of nurses we need every year, the number we're able to educate and help pass the national exams and get qualified to be in the workforce, that gap is going to continue to grow, especially since we know we are not going to be able to recruit our way out of this particular problem.
So that's an incredible challenge. And once we do train, we're only training a percentage of what we need. Is it difficult to retain those who are trained to remain in the state? What are some of the challenges about getting an individual who is now a certified nursing professional to stay and remain in the community?
We're pretty fortunate here in Utah. We believe that close to 90% of the nurses who are educated in our state stay in our state. So we are able to provide education to a robust nursing workforce, and they stay in the state. But the workforce, being 90% female, it is made up of groups of people who want to work part-time, people who want to work very part-time to maintain their license and their clinical expertise. And then there are people who want to work more full-time. About 2/3 of the nursing workforce works full-time. So we have a pretty significant chunk of our workforce that needs to be part-time for various reasons. And that's one of the great things about the nursing profession is that it's a well-paying job with good benefits and is when you are a nurse, you're able to contribute to your family, whether you're working part-time or full-time, and contribute to the economy in the same way.
So you talked a little bit about those individuals who make adjustments early in their career because there may be other circumstances in their life. A man or a woman could be contributing to raising family or have other obligations, and they're not able to work full-time. Some might even take a hiatus. Are there challenges for an individual to re-enter the nursing profession? Is there a recertification if they've had a period of time when they have not been practicing that would help towards the solution of meeting the need for nursing?
One of the great things about the nursing licensure rules and regulations is that a person can keep their license through a continuing education process every year. So if you're not physically practicing the art of and science of nursing. You're able to attend continuing education courses to keep your license current. If your license lapses, depending on how many years go by, there are more rigorous requirements, and we would want that because we insist on high quality in our healthcare institutions, but more rigorous requirements to get that license back. And it's possible. It takes about 8 to 10 months to regain your licensure.
Excellent. I know that we talked a little bit about the challenge of being able to absorb all the potential candidates and qualified candidates. In a few moments, we're going to talk to a couple of candidates who have expressed the challenges they've had getting into some of the nursing programs.
You're listening to The Wrap on Aging. I'm Janice Evans. I'm producer and content manager for the Utah Commission on Aging. Rob Ence and Teresa Garrett will be back right after the break. For now, I'd like to introduce you to two people who have tried and tried to get into nursing school in Utah. First, you'll hear from Anna Blanche. She's the mother of 2 boys, stepmother to 5 more kids. She's in her mid-30s and finally got into her first semester of nursing school at Weber State University. Welcome, Anna. First question, why do you want to be a nurse?
I think the science aspect of the medical field has always fascinated me from the time I was young. And just as I've gotten a little bit older, the thing that's drawn me to the nursing profession in particular is probably the social and emotional aspects of like the holistic aspect of caring for an entire person and not just addressing what's wrong with them. That's really interesting to me, and I'm really excited to get a chance to do it.
So you got to love people to be a nurse, right? You got to really care about people, and they're in bad shape when they get to you, aren't they?
Well, I mean, sometimes. I think you definitely do have to have that compassion and that desire to help people to be a nurse. I do.
So you're a mom, you're a wife, you've had a long journey to get in here to this point in your life, in your education. What have been the biggest barriers?
Well, for sure, the high point was actually receiving the notification this last year. I called my husband right up, and I actually was a little bit teary. It was just the culmination of a lot of hard work, and I'm so excited to get to start. Probably some of the low points, it's all worth it in the end, but there have been a lot of hoops. I've retaken classes where I did start when I was younger, the first time around in college, and then I had to drop out when my former husband and I found out we were expecting a baby. So there were some unexpected bumps. It was a blessing, perhaps. I loved getting to stay home with my children when they were young. But I did have to repeat some courses, and I have had some struggles with different nursing programs and different expectations. And so when I've moved, I've had to jump through new and different hoops because every program handles their applications and their admissions differently. So, for example, one program I applied to was first come, first serve once you pass all of the requirements. So I think the waiting list to actually start was over a year long. And then other ones have point-based systems, others have essays and letters of recommendation. So it's just been a little bit exhausting trying to manage all of that and make sure that my T's are crossed and my I's are dotted with all of the different requirements to try to cover my bases and with the different programs that I either did apply to or I was looking at applying to had I not gotten in this semester.
As a mom and a wife and having gone through all this stuff and being in your mid-30s, you bring something to nursing, even though you got 3 years to go, that a younger person may not bring to the profession. Can you describe what you think you bring to it that maybe a kid doesn't?
That's a great question. I think that having lived a little, having had a family and had just some experience that you only get through life, I have really gained some perspective on, first of all, understanding how much work it can take to do things and how it's very important never to give up. But just with some life experience, like I'm sure that most people who have had a baby can relate. Your first baby, at least I was sort of a nervous wreck. You're kind of learning. My poor first child was sort of my guinea pig. And I think the older that I've gotten, the more that I've learned to just take things in stride. And I've learned to trust my instincts and trust my gut. And I think that those are some really great life experiences that will help me when it actually comes time to, managing some patient care and, listening, being able to listen and communicate with people and understanding verbal communication and nonverbal communication. And that's been an invaluable thing that I've learned as a mom. So I think all of those things that really I've only picked up through life will be very valuable for me in this profession.
When you get through this 3 years of nursing school, if you, in a perfect world, what kind of job would you like to have as a nurse?
Oh, goodness. I don't even know if I can answer that question. I have so many interests. One of the things that appeals to me with nursing is just how diverse it is and how many opportunities within the profession there are. And so I do have a background in aesthetics, so that aspect, dermatology, those kind of things are appealing to me right now. But I honestly have no idea what's going to happen once I start having some clinical experiences. I don't know what I'm going to be drawn to. I'm keeping my options open and just trying to keep an open mind. And I'm just excited to try something to feel.
What would you say to people who are discouraged, having tried to get into nursing school in Utah? What would you say to them, having crossed the bar?
Don't give up. I know it's discouraging sometimes. I know it can be hard to see people who you go to class with or your peers. They might get in, you might not. It doesn't mean you're not qualified. There's just not as many spots available. I mean, everyone who gets in is qualified. That's why it's so competitive. And I would just say, stay the course, keep your head down, one foot in front of the other. But if this is something that you really want to do, don't give up. I'm 34. It didn't work out for me when I was 19, 20. It's okay. I'm doing it now. Don't give up.
Is there anything else you'd like to add, Anna? And we surely appreciate your time and your sharing your experience.
Oh, well, thanks for talking to me. I think that this is just such a vitally important area for us to be focusing on. We need nurses, and we certainly don't want to turn people away who would be wonderful nurses. So I think anything that we can do to move forward and make some progress with this issue to allow qualified, passionate people get into a career that they are aspiring to and would love and would do a wonderful job at, I think is a really important thing, especially with how many nurses and general population are as they age. It's just, I think the importance of it can't be understated. We've got to plan ahead, or we might find ourselves in some hot water.
For sure. Thank you, Anna, and good luck. We'll stay in touch with you. And Utah's lucky to have you, an aspiring nurse and soon-to-be nurse in 3 years when you graduate.
BSN, 3 years. Here I come.
Now, we'd like you to meet another aspiring nursing student, a young woman who lives in Utah County. Her name is Leslie Montgomery. She's such a great student, she got a scholarship, and she's tried to get into nursing school at Utah Valley University. And she's still trying. Welcome, Leslie. How many times have you applied to get into nursing school?
Twice. For a year, yeah.
For a year. And you were like a superstar, almost a 4.0. That's why you got in high school, right? And that's why you got a scholarship?
Yep.
Boy.
3.98, yep.
You would think that would be enough, but then you would be wrong.
Yep.
Right? So,
unfortunately, that's the case.
So first, Leslie, tell me why you want to be a nurse.
Well, I have the stereotypical answer that basically every nursing student says, that they want to help people, and that's true of me too. But I love the human body and the way that it works, and I've just become so passionate about learning about different diseases and being able to kind of to learn what it takes to treat these diseases and to help the people that are going through these processes, even if they're not treatable, to be able to have a healthy, or even if it can't be healthy, but a happy life, and be able to be comfortable and work through some of those illnesses. So it really intrigues me to be able to help those people and make people feel happy. It's really rewarding to me.
So you told me that at first you couldn't even stand the sight of blood, and then what happened?
That's true. So I ended up taking a human anatomy and physiology class in high school, and a sports medicine class, and as well as first aid, actually. And I just became intrigued with it. I can't even tell you what really happened that made that change happen, but it did, and I can handle it. I'm an EMT now, so I can handle looking at it. I teach EMTs, so I see it a lot in slides and stuff and things like that. So it just, I don't know, my brain just flipped. As soon as I started studying it, I just fell in love. So
you're an advanced EMT. What about being an EMT what makes you love that?
And I think it's kind of the similar reasons why I want to be a nurse, and nursing just seems like the next step in my career choices. But being able to be there for someone in their worst day of their life kind of scenario, and being able to have the knowledge that it takes to either save their life or help prolong it and make them comfortable through some tough times is really rewarding to me.
And save their lives.
Yeah.
So you've also been working with people with ALS and MS. Can you describe what that's been like as an experience for you?
Yeah, so I stopped doing that it's probably been a little over it's been about a year since I stopped doing that. I was mostly working with ALS and muscular dystrophy, not MS. But it was super eye-opening to these diseases that these people are dealing with long-term, that there is no cure for, and that we're just going through treatment as best that we can to help keep them comfortable and prolong life as much as possible. And it's been really eye-opening to meet these people and become friends ultimately with these people that just become such a bright part of my life. And it's been really rewarding to be able to help see them be more comfortable in their lives, even though they know that it's a terminal illness. So.
And how do you help them? I mean, that must be so discouraging for them to know that whatever they do, it's not going to cure what's wrong with them.
Oh yeah, I mean, it was difficult at first because I kind of let it hit my heart, which I had grown to love these people. But I think the best way that we can help them, I was just working as like a medical assistant, which actually I got to see them a lot more than even some of the doctors sometimes. But just to become their advocate and to become someone that they feel like they can trust and they can come to, and that if they're having any problems or if they're feeling upset or down or whatever it is, that they feel like they can come to me or they can come to another one of the staff and help work through those problems with them and help them be comfortable is basically what I was doing. It was just being their advocate, essentially.
So it doesn't sound like you are a giver-upper. So are you going to keep trying?
That's the plan. My scholarship's about halfway up, so that's a little bit discouraging as far as getting into nursing school goes, because if I only have 2 more years left of my scholarship after this semester, then it's kind of cutting it close on that, and it's going to end up putting me in debt later on when if I have to end up having to pay for school at the end after my scholarship has run out. So that's kind of frustrating, and it's kind of, obviously making me feel like I want to maybe go into something else because of all these barriers that seem to be in my way.
What would you say about you changing your goals and what a loss that would be for your community? That seems a tragedy to me.
Yeah, it's not fun, and it would be a hard decision to make at this point in my life, especially because, I need to help provide for my own family that just started, and I need to be able to be having a job and making money out in the field. And if I don't get through school for another 2 more years, that kind of prolongs that. But at the same time, it's hard for me to give up this thing that I've been wanting for a long time, that I have this passion for,
Sure.
for something else that I also love, but that is kind of different. It's just it's a change of life direction totally. So
what have your counselors told you? What have your counselors at UVU told you?
So the one that I've talked to, she kind of said that the last couple of times that I've applied, that they had way more applicants than usual, and that if I just did it again, then I'd get in, type of a thing. But other than that, I didn't get a whole lot of feedback. Ultimately, she just told me that my grades were good, my entrance exam score was good, and that I just needed to keep applying, essentially.
That must be so discouraging.
Yeah.
So you got 2 years of your scholarship, and then you got to go on your own dime. Is that it?
Mm-hmm. Yeah, that's true.
What would you like to tell members of the legislature about your passion for nursing and why it would be a loss if you had to go another direction?
Well, I think that, for me and for a lot of other people, I'm not the only one that's going through this. Obviously, you guys have a bunch of people you've talked to, and I have a bunch of people just that I've met in the classes that I've taken as prerequisites that are also trying to get in and are having a difficult time. I have 2 cousins that are also trying to get in that are having a difficult time. And I think that without funding and without all of these teachers and open spots for us to get in, they're losing some of us that are very qualified and very passionate about this. And I can't say that that's not true for the people that are getting in, but because there's going to be such a shortage in the future as we move forward, and there already is a nursing shortage, I think it's taking away from not only their future care, but our future care, my generation's future care, to lose some of these people that are so passionate and so good at what they do and want to be a part of the nursing community, but that can't get in, and that's the only thing that's stopping them.
So since you're such a rock star, I'm sure you're going to get in at some point, but let's say you get through nursing school. Do you have any vision about what you want to do when you get out of nursing school, what you want to practice? Is there a dream that you have that you'd like to fulfill?
So I kind of have a couple of different ways that I could go. My big thing that I've always been saying that I want to do, that as far as I know, I want to do is like life flight. Any kind of flight nurse I think would be awesome. But to get to that point, there's a lot of other steps that I'd have to take, working in an ER and working in an ICU and stuff like that, which also sounds like it would be super right up my alley. And then kind of on the other side, I have such an interest in sports medicine as well. I think it would be really fun to work with either under a sports med doc or in some type of clinic to that effect. I think both of those would be right up my alley where I would thrive.
You are listening to the Rap on Aging podcast from Scope Radio at the University of Utah. I'm your host, Rob Ence, with the Utah Commission on Aging, and today we are talking with Teresa Garrett, Project Director for the Utah Nursing Consortium and Assistant Professor of Nursing at the University of Utah. We've just heard from two individuals who experienced some challenges and barriers to entry of getting into the nursing programs, primarily because we don't have enough seats at the table and enough faculty. Let's talk a little bit about that shortage and what we're confronted with in terms of having qualified faculty in the state of Utah's nursing programs.
Nursing faculty requirements are advanced education. That's the first piece. Clinical expertise is the second piece, and scholarly activity, which is essentially what we say about gaining knowledge and then distributing that to the rest of the workforce so that we all get better because of the research and the activities that go on within the nursing profession. It is challenging to recruit nurses from the practice environment to the education environment unless they're really ready to make a career change. So myself, I practiced for many years in the community and was ready to come to the University of Utah to teach because it's a point in my life where I'm ready to do that. The one thing I did have to do with that was my pay is a little bit different than it was when I was working in the community. So that's a challenge. The other piece to it is that we're asked to do many things with students and be in multiple places. It's requires a lot of expertise. And so, for instance, to teach one nursing student takes a faculty member who has faculty members who have expertise in maternal child health, pediatrics, mental health, behavioral health, critical care, medical surgical nursing, any number of the areas of expertise. So as a college, you have to recruit all of those areas of expertise into your university. We're pretty fortunate here in the state of Utah. Our schools are very full. We have faculty members who are capable, and we're producing, for the most part, students who pass their national examination the first time they take the test at a very high percentage. So we are producing a high quality product, if you will. So we know we have good faculty members. We have solid students. We could use more faculty members, and the only limitation there is funding. A public institution can only hire as many people as they have budget for. So more faculty would mean more students in our programs.
And I'm assuming there are critical ratios in terms of faculty per student that impact the quality of that education.
That is a very important point. Thanks for bringing that up. The ratio is somewhere between one faculty member and 8 to 10 students. And that's because when our students are in a hospital setting, a nursing home, a home care agency, and they're providing care, quality and patient safety is our number one priority. So that close clinical supervision and mentoring and guidance that a faculty member provides to a student is very important.
That's great. So let's talk a little bit about how nursing touches our lives. I know that you mentioned there are many disciplines in the educating of this profession, but every individual encounters a nurse at many points. Let's talk about how that shows up in our society. If there were no nurses tomorrow, how would we know that?
We would not be as healthy as we are. So nursing, when you ask me that question, it almost, it makes me pause because I've been a nurse for 35 years. I've been a nurse longer than I've been anything else in my life. And it's a profession that is near and dear to my heart because I get the intimate experience of helping a person when they are pretty vulnerable and they need help and guidance and care. And as a nurse, I can do that when you're an infant, when you're a neonate, when you're brand new to this world. And then I also get to be with you at the very end. And all those touch points in between when you need care and you need help and guidance and assistance to become a much healthier person. So there's the very personal one-on-one intimate experience that that nursing provides to people. And when I talk to people about what we're trying to accomplish with the Utah Nursing Consortium, it's it's a very wonderful experience because I'll say to someone, I'm here to talk to you about the nursing profession. And the first question always is, oh, are you a nurse? Yes, I'm a nurse. And then the next question is, well, how long have you been a nurse? What have you done? A few things like that. And then immediately a person will start telling a story to me about how a nurse has made a difference in their life, whether it's been a grandchild who was born early and the nurses in the NICU, the neonatal intensive care unit, were so compassionate and so caring, or a hospice experience where a person is at home. The way that nurses touch people on a very intimate basis is it's a privilege, and we count it as a privilege. The other thing that we know about the nursing profession is that when we have more nurses in the population itself is healthier. More people get mammograms. More people are well immunized. Fewer teenagers get pregnant. It's a really interesting phenomena that's been studied across the United States. That when you have a higher ratio of nurses to the number of people in your community is healthier.
These data tell a very, very important story. I want to say that from my personal experience, how you described the interaction we have with nurses in our lives at some various points. 5 years ago, my parents died a year apart. In both cases, we can honestly say that the angels in our society at that time were the nurses who gave that palliative care at the end of life. And in fact, when 7 siblings couldn't get parents to do certain things, the nurse could always find a way to convince them what was in their best interests and the choices that they had to make. And it does make a difference. And it's something that I think every individual can tell a story of how that profession has intersected with their life in very, very meaningful ways.
And just thank you for saying that. That's really kind. And I'm really, really glad that a nurse was able to be there to help you and your family. And we consider it a privilege and an honor to be a part of that in a person's life.
Long and short of it is none of us can imagine what our world or society would be like without the care and professional approach of nursing. You're listening to the Rap on Aging podcast from Scope Radio at the University of Utah. I'm your host, Rob Ence, with the Utah Commission on Aging, and today we are talking with Teresa Garrett, Project Director for the Utah Nursing Consortium and Assistant Professor of Nursing at the University of Utah. Teresa, tell us a little bit more about the consortium. Who's involved, which organizations, and what are they trying to do?
The Utah Nursing Consortium was founded in June of 2016. We started with the deans and the directors of the 8 public schools of nursing across the state. And we stretch from St. George to Logan and from Tooele to Vernal. And those deans and directors came together in partnership with the Utah Hospital Association, the Utah Medical Association, the Utah Nurses Association, and a variety of concerned citizens who support schools of nursing across our state to begin to address this issue of a changing nursing workforce and the challenges we're having today caring for our population.
So the consortium is dependent upon the collective work and the voice of the community to help tell the story of why this is important and how we overcome the barriers to entry to increase the professional population of nursing services in our state. And again, you said it's a nationwide program or problem, but the state of Utah has some very unique challenges. Again, higher birth rates and larger growing demographic, 85 plus, and that brings with it, as you indicated earlier, a whole host of challenges. So let's talk a little bit more about the barriers to entry into this workforce. We addressed earlier the fact now that we have shortage of slots. We've heard from a couple of individuals who expressed the concerns and challenges. Somewhere this all has to be paid for. Where do the resources come from that would help us increase the faculty capacity and student capacity?
College is funded through a variety of mechanisms. tuition helps cover certain expenses, support from our state government. We get assistance from the federal government through grants and other resources that come to bear. And right now, probably the most important thing that we can do is ask the Utah State Legislature to support the Nursing Consortium so that we can grow the number of faculty members and increase our class size to help respond to this gap that we're experiencing in the workforce.
And if I understand correctly, we're not even holding ground. Every year that passes without additional funding, we're actually going backwards.
That's correct.
And so the capacity is not even coming close to meeting the demand, and the demand and capacity gap the gap is increasing.
It is, and that's a pretty complex problem in healthcare in general. We will never have enough physicians. We'll never have enough physical therapists. We'll never have enough nurses to meet all of the need and all of the demand. So we have to be very creative in healthcare to make sure that we're doing things to make sure that the services you need are available when you need them. And we could have a whole nother conversation about what healthcare systems are doing to help people access healthcare in a variety of really unique ways to decrease the demand for physical presence. There's lots going on with computer-based interactions and group visits and extra care management services that health systems are being very creative in trying to meet that demand.
Do you have any thoughts on how we might incentivize individuals seeking this profession to focus on geriatric care and end-of-life issues?
So it's interesting as I help students. So I teach in the second semester of the nursing program here at the University of Utah. And it's really interesting to me, by the time they get to the second semester, students have already sort of begun to gravitate in certain ways and in certain places within the healthcare profession. There are always going to be a group of people who really want to help babies come into this world. And I'm grateful for that.
You bet.
And there is a growing number of students who are really interested in primary care. So, basic wellness care. And there's another group of students who are really interested in end-of-life education and activities. And in fact, we across the state offer some additional training for nursing students so that they can understand those end-of-life nursing needs, patient needs, and resources across the state.
We talked a little bit about what incentivizes individuals to practice in the state of Utah. Do you see other challenges that our public policy leaders need to address in order to make this a welcoming environment? We talked a little bit about wage. What about wage? What about the health of the climate in our area?
Well, everybody always wants a raise, so we'll leave it at that. The unique thing about the nursing workforce is that because the demand is high, it is a well-paying job. A nurse who works full-time and has maybe 5 years of experience makes close to $70,000 a year. That's a great job to support a family, to raise kids, make a house payment, do a few other, go on vacation. That's a great job for a person. Plus, you get to be a nurse. So there is that. Because we have to recruit so many nurses from outside right now to respond to our need, there are other challenges in our state that groups like the Salt Lake Chamber and other organizations have well recognized. The cost of housing in our state is an issue. The availability of housing is an issue. All of us are concerned about the quality of our air and what we can do about that. There are other issues that if you're going to recruit computer scientists to come to Utah, you need to deal with those issues, as well as a healthcare workforce to come to Utah.
So one of the challenges we talked about earlier was the retention factor. When people are trained, they leave. There's also the fact that sometimes individuals 4 or 5 years into their career make some decisions to leave the profession. What drives that? What's behind that decision?
We know that about 20% of nurses, as well as educators, teachers in our schools, and other professionals, leave the profession within the first 5 years of working in that arena. These are not easy jobs. The perception that you're supported is not always felt. You're dealing with a lot. You're thinking, I think about my education peers. They're thinking that they're going to go into this profession to teach first graders how to read. And little did they know they had to deal with the families and the communities and the funding and the changes. Well, the same thing is true in the nursing workforce. I want to become a nurse because I want to help people be healthy and live to their healthiest potential. And not only do I have to help that person, but I also have to teach the caregiver how to take care of the patient. I have to deal sometimes with some angry family members. I get myself in some not so great situations because of the tension that happens in families and communities when people get sick. And that's hard. It's a hard job. So it's not for everyone, and people do change their mind and they go do something else.
Right.
So that happens.
Decisions in life are tough anyway, but when you're sick or when you're, end of life challenges, those are not easy conversations to have. Well, we're grateful for everything that you're doing with the consortium and for your career choices. We want to thank you very much. Is there a last thought you'd like to share with the general public, our listening public, and our public policymakers about the importance of why we need to make sure we have robust support for our nursing profession?
The challenge in the nursing workforce is that in the next 15 years, which isn't, it's a blink of an eye if you think about it, a whole bunch of nurses are going to leave the workforce. And that means that we're losing the experience that comes with time when you're in a profession. My father-in-law was a lawyer for 55 years, and he used to regularly say, well, people make disparaging remarks about lawyers until they need one. And when they need one, they want the most qualified one they can find or they can afford. And the same is true with a nurse. When you need a nurse, you want a really highly qualified, experienced, well-educated nurse to help you through your health challenge. So the time is now to begin to increase the number of faculty members in our nursing programs at the public institutions, public universities, to increase our class size. And we have an opportunity to increase our class size by a pretty good percentage this year with some support from the legislature. So we have a great opportunity to make a difference in the changes that are coming to the profession through some legislative efforts and work that we're trying to accomplish. And we would appreciate anybody's support in getting that done.
Terrific. We all have a need now and a call to action to get involved and have our voices heard. Thank you, Teresa, and thanks to all of you for listening today. You've been listening to the Rap on Aging podcast from Scope Radio at the University of Utah. Our guest today has been Teresa Garrett, Project Director for the Utah Nursing Consortium and Assistant Professor of Nursing at the University of Utah. If you have any questions about this issue or suggestions of topics you'd like to talk to us about, please send us an email to utahaging@gmail.com, and be sure to check our website at www.ucoa.utah.edu and follow us on Facebook. I'm Rob Ence, Executive Director of the Utah Commission on Aging, and this has been the Rap on Aging.